So you have your medical cannabis card in Utah and you want to visit a pharmacy. There's a couple of things that you want to do before you get here. One, you want to make sure you have a little cash because they aren't going to take your credit card or any other form of payment. You can register for Hyper as HYPUR as an alternative payment method if you want to do that. You want to print out your medical cannabis card as well. And finally, most important, you've got to go online and schedule an appointment to visit with a pharmacist when you get here. Come on. When you get here and walk through the door, you'll be greeted by a person behind the glass. It's a little daunting at first, but don't worry, they're very friendly. When you get into the lobby, you'll have to register as a patient, show your card, your driver's license, so that they can check you in. Once checked in, a pharmacy agent will come get you and guide you back to the pharmacist's consultation room. Today, we're meeting with Josh.
Have a seat, Tim. How you doing?
When a new patient comes to your pharmacy, what's the discussion like when they get in the room?
We're going to make sure it's a nice experience for them to come in and have a seat. We're going to be upfront about what we're going to ask them and kind of walk them through the process of how it's going to go in the consultation room. I like to start off by introducing myself and then asking them some of the questions that we're required to ask of them. So we have to, one, go over a medication list with them. Oftentimes the QMPs don't put the medication list in their EVS profile. So EVS profile is the electronic verification system the state of Utah has that registers and maintains the list and database of all medical cannabis patients. It includes all their information, their disease state, their qualifying condition, and their recommendation from the QMP and their limits that are associated with that.
Remember, they're going to talk to you about your medication list, what medications might interact with cannabis, starting new cannabis therapy. Be sure to be honest about your cannabis use because that's the way they can help tailor the treatment to fit what you want with the cannabis therapy. If I'm scared about different product types or I have no experience at all, is that okay? Do I need to know anything about cannabis before I come?
You don't need to know anything. That's what we're here for as pharmacists in this market, is to educate our patients. And when they leave our building for the first time, we want to make sure they have a clear understanding of how they're going to be treated and how to use the products that they're going to purchase.
Do I have to buy marijuana flower?
No, you don't. So what we have is a system where the patient is going to make the decision. The QMP and myself, we recommend the products to the patient based off of their qualifying condition, but ultimately it's up to you, the patient, to make that buying decision.
This sounds a lot better than what I was afraid of. As a new patient, we have a lot of patients who are afraid they're going to get here, they're going to get introduced to flower and grinders and learn how to roll joints.
Yeah.
That's just not the process.
That's not the way it is, not in a medicinal market. We're going to walk you through the products that are available to you from your QMP that they've allowed you to use, and then we're going to show you how to dose them correctly and when and where to use them. And
when we get done with that consultation, what happens next?
So after that, we'll escort you out to the medicine room floor while I introduce you to one of our pharmacy agents. They're going to be the ones walking you through the products a little bit more in depth than what I can offer in such a short time. They're going to be able to spend more time with you in that. They're going to go off of the recommendation that I'm giving them and that the QMP has given the patient and help the patient pick the products that fall within that guideline.
After the pharmacist consultation, you should feel comfortable enough to choose a couple of products to start with, like a topical or a tincture or something that is going to work for your condition. If you need something inhaled, the pharmacist will educate you on the appropriate accessories that you might need to use that product. Remember, when you go to the pharmacy, you'll need to bring cash. If you don't have cash, don't worry. They have an ATM at every medical cannabis pharmacy in the state. When you buy your product, the pharmacy agent will go back to their vault and retrieve that product and bring it out to you. Everything's going to be locked and secured in a child-proof package and a smell-proof package, really.
Yes.
And you're going to be out the door. The whole process takes about 20 to 30 minutes, including the consultation time. I know this is kind of scary for a lot of people, but it's okay. You don't have to use products that you don't want to. You don't have to take products that are too strong. Every step of the way, the pharmacist and the pharmacy agents are here to tailor that therapy for your condition and your needs, and also to answer any and every question that you have about the therapy, about other medications that you're on, and you can always go back to your Q&P for more information. Remember, anytime you need a dosage increase or you want to buy more cannabis than you're allowed with your Q&P's current recommendation, call your Q&P office before you come so that they can adjust that dosage in the EVS system before you get to the pharmacy. If you happen to run into your limits on purchasing at the pharmacy, the pharmacist or you will need to call your Q&P office. Sometimes that takes 2 or 3 days to adjust your dosing. So trying to stay ahead of that is really important. So you finished with your first pharmacy visit. A couple of tips and tricks for next time. You only needed to meet with the pharmacist once. That doesn't need to happen again. You can always ask them questions later if you need. Be sure to ask if your pharmacist or your pharmacy has drive-through, curbside, or delivery options if that works out better for you. And if you can't get to the pharmacy, you can always ask for a telephone or a telemedicine pharmacist consult so that you can do this from the comfort of your own home.